Dear students, welcome to game. In fact, one of the easiest of the games. Gross and microscopy explained. This shall be exactly the structure that will be focused for you people under the microscope. And I hope you guess what the organ on my left is. Cysticercosis. It is a university short note in pathology, a slide, an MCQ, etc. But a definite university question and an essay in parasitology. The definition of a cyst is a bladder-like translucent vesicle. It can form part of a parasitic cycle. It was discovered in the parasitic cycle in the 17th century. It is composed of two parts mainly, namely the vesicles or the bag-like structure and a scolex or head. The vesicle itself is made up of three different layers, namely an outer cuticular mantle, middle epithelial cells, and an invaginated scolex. These are the three parts of it we shall just remember. By the way, the vesicle itself is a fluid-filled cyst or a sac. This is a picture of a brain parenchyma which is having, in fact, loaded with multiple cystic lesions measuring about 1 to 1.5 centimeters. That will be the exact gross measurement of it. And it can be caused by Tinea solium or Tinea saginata. Tinea solium is the pork tapeworm. And man happens to be an intermediate host. The host itself can be a definite host or an intermediate host. Look at this particular cycle. Man or the cattle can be contaminated with these, and then there will be passage of the eggs. These again are devoured by the animals and the cycle continues. Whereas for man, he consumes the muscle or the beef or the pork, as a result of which he gets infected with it. Within man itself, when it traverses the intestine, goes into the circulation, it gets lodged in various parenchymal organs or the muscle itself and develops into a cyst. So these are segments of the parasite which can measure several centimeters, rather meters long. And there is a head that is having the rostrum or the hooklets. And this is exactly the lesion that we will be seeing. A cyst is actually developed in an unfavorable circumstance. The cycle is not able to continue. At the same time, the organism wants itself to be preserved, as a result of which it develops a very thick cuticle outside. And there is an infolding of the epithelium. It develops what is called as a thick chitinous lining. Chitin is skin. So it has got such a lining over here. And ultimately the lumen develops a holy leaf-like pattern. A holy leaf-like pattern will be having an irregular lumen. If we are lucky enough, we may be seeing a scolex, that is the head part of it, along with the hooklets. This again is a classical one. It's a slide for the examination. I am able to find an invaginated canal with a chitinous lining, which will be somewhat pinkish, eosinophilic, and anucleated. And these are the walls of it. Externally, there can be an outer chitinous lining that can be seen. So this is called as a holy leaf-like pattern. Compare this leaf with this, you find that the outlet of the lumen is more or less similar to the holy leaf. And as I told you, if you are lucky enough, you can see the scolex or the head along with the rostrum and the hooklets. Now in this particular cycle, what happens is, from man you find that there can be a contamination and then the cycle continues in these animals. In cow it is the Tinea saginata, whereas Tinea solium in the pig, the pork tapeworm. At the same time you find in man, from the intestine, it can traverse the intestine, enter the circulation and go to organs such as eye, brain, muscle, etc., wherein it is not able to proceed any further and develops into a cyst. And in this cyst, you find that there is a development of the parasite, but it is not able to go any further. It encircles itself in a very thick walled cyst, and there is an invagination. This is exactly what we will be seeing either in the subcutaneous region or in the parenchyma or the muscle, etc. Look at this. So the outer pericyst has been removed and the inner cyst is somewhat translucent with invagination. Many a great person has been diagnosed with brain tumor, but ultimately it turned out to be a case of cysticercosis. See you in game 42.